Hello and welcome to our latest edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and today we're at Sanford Research and we are with Dr. Emily Griese. Good morning.
Good morning.
Before I ask her some questions about her pilot grant, I will just give a little brief bio about her and then go ahead and get into her work that she's been doing. So, Dr. Griese received her PhD in educational psychology from the University of Nebraska-Lincoln. She completed her postdoctoral work in health disparities and prevention research at Sanford Research, where she is currently an associate scientist in the Center for Health Outcomes and Population Research. Dr. Griese's research focuses on longitudinal, person-centered modeling, working to identify sources of resilience among peer victimized or at-risk youth. She is interested in examining longitudinal victimization rates and mental health outcomes among American Indian and rural youth in South Dakota. She currently leads evaluation efforts for a project working with American Indian male victims on the Rosebud Sioux tribe. She also directs the Sanford Data Collaborative at Sanford Health. Her pilot grant project worked with Maternal-child dyads following their time in substance abuse residential treatment. So Emily, why don't you go ahead and tell me a little bit about your pilot grant project?
Yeah, so my pilot grant project worked particularly with the Volunteers of America Dakotas here in South Dakota, and we worked with their program for pregnant and parenting women, and so it was really doing a post-treatment follow-up with the women and their children. So what we find in the literature is a lot of findings really focus on what are the mom's outcomes post-treatment, but there's less research that really focuses on what are the child's outcomes, because a lot of times we find that women who are going through substance abuse treatment are often pregnant at the time or are parenting at least a child or more, and so understanding what that relationship looks like is really important. We also wanted to focus on, for this particular program, the cultural aspects of the program. So they had a really high American Indian population that worked with this program, or that went to this program, and so they had tried to do some efforts to incorporate culture into the program, but they weren't really sure if it was working or not. And so our research was really to start looking at, was that working, and what parts of the cultural programming were working well. Okay. That's what we started looking at.
So anything with your outcomes that you did find recommendations with?
Yeah. Yep. So we, so for the mother-child data, what we found was that mothers with lower than a high school education were significantly more at risk than mothers who at least had a high school education or higher. So we found in the home assessment that we did, so this was really just looking at how the mom and the child interacted, and what we found was that those with less than a high school education were significantly lower on parental warmth, so how warm they were to their child during that time when we were visiting, and then also just having books in the home and having some of those learning materials available to the young child. And so what we were able to do was talk to the program about, when the moms are in your program, talk to them about getting their education, talk to them about maybe, completing their GED while they're with you, and then also setting them up for success in terms of having those resources for their children in their home. So maybe setting them up with the Dolly Parton Imagination Library or something like that, where they would sign up for it before they left so that they would get those books when they left the program. Our qualitative findings that looked at the cultural impact of the program really found that each woman was just very unique. So I think we tried to kind of put a blanket around, maybe the American Indian woman would really want these specific cultural practices, and the non-Native women would want different practices. And really what we found was that each woman talked about kind of wanting to have that conversation with someone at the program of what their culture was to them. And for many of the women, it was a kind of a hybrid culture of maybe very mainstream culture, maybe some Native culture, but they were really kind of figuring out what that meant for them and how that would impact their recovery. So when we talked to the program, we really just told them, make sure that you have those conversations with the women and ask them early on, what are their specific needs so that they feel like those are being met.
Awesome. Those are really great recommendations.
Yeah.
Anything else you want to share with us?
I think those were the big things. Yeah, it was it was very interesting. I think I shared this a little bit yesterday in my presentation, but it's always humbling to have people, I think, let you into their homes to actually do research. And so it was really interesting to see to see how welcoming the mothers were to us as researchers to come into their homes and to be able to have that interaction with them and their child, and just get to talk with them about their time in treatment. And they were very open. So lots of lessons learned around that
Awesome.
process.
Well, thank you for your time today.
Yeah.
And as Emily said, she did present the other day, so we will post that on our CRCA page, and we will let you know via Twitter and Facebook and probably a few other email postings. But again, thank you, Emily, for your time today,
absolutely.
and we will see you on the next edition of Inside CRCA. Bye.
Thank you.